What you see on the screen is an anatomical picture of the Sang and Fu organs proposed by the Neijing, also known as Emperor's Internal Canon, the oldest medical text of the traditional Chinese medicine. According to the Neijing, the universe is ruled by two opposing and complementary fundamental forces, the yin and the yang, a duality expressed in the human body as Sang and Fu. Thereby, the heart is a Sang organ and is related to the small bowel and the tongue, since the first one is its Fu organ assigned, and the second one is its reflex sensory medium. The heart, or Zin, is in charge of controlling blood vessels, which are the headquarters of the mind and the spirit. As you see, painting was the only cardiac image technique available in ancient times, and in spite of how much the world has changed since, we, present cardiologists, keep drawing hearts. Hello, welcome to Cardio Flash College, a place to learn cardiology with flash animations. As you know, in this channel we try to represent with drawings the complex and fascinating world of the cardiology with the objective to ease the process of academic formation. However, we are not the first to do it, because the heart has been the object of study and devotion since the beginning of time. The visual perception of its beats and its unremovable connection with emotions have motivated the interest of an uncountable amount of people to unravel its mysteries and immortalize in an image its functioning. This is why these are 5 images, dilated cardiomyopathy. Number 1. As you know, the dilated cardiomyopathy is an entity that includes an heterogeneous set of diseases which produces a series of structural and functional disorders of myocardial tissue causing biventricular or left ventricular dilation and a systolic dysfunction of the left ventricle, with absence of significant coronary disease or abnormal charging conditions such as arterial hypertension and valvulopathies. This disease can be the result of specific genetic alterations or due to the exposure to environmental agents or the combination of both, for example, infections, toxics, metabolic or autoimmune diseases, among others. The usual clinical manifestation is heart failure, tachyarrhythmias, or sudden death. And although the etiological study is needed to optimize the treatment and to define the prognosis, today we will focus in the initial study of this entity, that is, in the general information that we can obtain from the most common diagnostic tests in clinical practice. In this way, the chest X-ray is one of the most accessible image tests nowadays. We can measure the cardiothoracic ratio with it, evaluate the outline of the cardiac silhouette, the pulmonary hillock, the bronchovascular weft, and the costodiaphragmatic recesses. Thereby, we can see in this case that the cardiothoracic ratio is clearly augmented at the expense of left cavities with congestive hillock, redistribution of the bronchovascular weft, and effacement of the left costodiaphragmatic recess. All of these radiological signs are compatible with an acute heart failure and a left pleural effusion in a patient with a probable underlying structural heart disease. Number 2. The electrocardiogram is usually pathologic in patients with dilated cardiomyopathy, although its findings are not specific. It is frequent to find a delay in the intraventricular conduction secondary to the ventricular dilation, Q waves, and signs of left atrium growth. In this case, the electrocardiogram shows a complete left bundle branch block with a QRS of 260 milliseconds and secondary alterations of the repolarization. As you can imagine, this is a very pathologic electrocardiogram that must make us think in an underlying cardiopathy, forcing us to deepen its study. Number 3. The echocardiogram is still the initial diagnostic test for analyzing the cardiac function and morphology in patients with suspected dilated cardiomyopathy. Although its findings can help us identify a specific etiology, an underlying cause cannot always be established. Thereby, as you can see in this case, the left ventricle is severely dilated, presenting a spherical aspect and an asynchronous contractile activity, which determines, as a whole, a very severe systolic dysfunction. On its own hand, the myocardium is of normal thickness, and there are no valvulopathies nor charging conditions that could justify the structural damage of the cavity. Number 4. The study of the coronary anatomy is a practically essential requirement in those patients with dilation and dysfunction of the left ventricle because it is necessary to differentiate the dilated cardiomyopathy from the ischemic cardiopathy in dilated phase. As you can imagine, there is an underlying severe coronary disease in patients with ventricular dilation and dysfunction due to ischemic heart disease, while there is not in patients with dilated cardiomyopathy. In this case, left heart catheterization does not allow to perform not only an invasive coronary angiography with the intention of discarding coronary disease, but it also allows us to perform a left ventriculography with the objective of evaluating the size of the cavity, estimating the ejection fraction, measuring the filling pressures, and discarding the existence of mitral regurgitation or aortic transvalvular pressure gradients. Number 5. Finally, the MRI is an essential tool in the diagnosis and the prognostic stratification of patients with dilated cardiomyopathy because it allows us to analyze precisely the ventricular morphology, the tissue composition of the myocardium, and distribution of the gadolinium in a late enhancement sequence. In this case, it is evident that there is a severe left ventricular dilation with an asynchronous and severely decreased contractile activity with a late intramyocardial enhancement at the infrabasal wall, suggestive of replacement fibrosis. As you see, the dilated cardiomyopathy is much more than a simple heart disease, since it includes a set of heterogeneous disorders that only have in common the dilation and dysfunction of the left ventricle. However, this subject is much more extensive than we can cover in this section, so we will conform with the aspects related to the initial study of this entity. It has been all for today in Cardio Flash College. We hope you liked the video. If so, subscribe to the channel and leave a like. We'll see you in the next class. And remember, don't come late. Bye!